Today's episode is part one of my Surviving COVID-19 series, where I speak with survivors of COVID-19 as well as the essential workers who were on the front line saving our friends and families' lives. Today's episode, I'm speaking with my dear friend, Miss Shayna Wilson. Hi guys. Today's episode I'm speaking to a really good friend of mine, Miss Shayna Wilson. Me and Shayna have been really good friends slash co-workers. She used to do my PR back in the day. Well, she still do my PR. She created my whole everything. So she is a good friend of mine. But today we're going to talk about her journey surviving COVID. I know a lot of people um, have been touched by the COVID. I don't want to say disease, but just the effects of COVID. Either you've lost someone or you know someone who had COVID. But a lot of us who haven't been through it personally, we don't know exactly what dealing with COVID-19 is and the after effects. So I wanted to put some highlights on people who has actually experienced COVID and survived. And I'm so happy that my dear, beautiful friend has survived COVID and she's willing to share with us her journey. But I'm going to let her introduce herself and who she is within this industry. We met in this industry, and we'll get into that afterwards of how we met and our beautiful friendship. But I'm going to say, Shayna, take it away.
Thank you so much, Tonya. Yes, my name is Shayna Wilson, just telling you stated, and I'm a publicist, an entertainment publicist, and I also work in the nonprofit and tech sector. I'm also a talent manager and a writer. So yes, it's a blessing to be here talking with you today, and I'm so honored to share my experience having COVID.
Yeah, I was talking to another friend of mine who shared their experience about having COVID. And when they were telling me about what they went through, I said, oh my God, I need to talk to people who hasn't experienced it so they could know what was going on, like how the experience was, what the symptoms was like. That way we can be more aware. And one, we can stop the stigma of people having to be scared to share that they have had COVID because they've had it. So we need to stop running away from people like it's the plague or something. And we need to be more aware and more educated on what this actual experience is. But let me get into who Shayna is to me. She is my beautiful friend. We met at an event. Where did we meet? We met at some type of event. Was it the Kim Kimball event? Was it? Was it the Kim Kimball event where we met?
Yes. Kim Kimball's event.
Yes.
We became like instant.
Yes. And you know what's so funny? I was just literally looking at those pictures and my phone. They popped up where me and you and my friend Asia Monet, and we were taking our pictures in the photo booths, and it was like we instantly bonded. It was like, yes. I'm like, yes, this is my girl. And yeah, and then you came to my fashion event, and we just been the closest. And Shayna stepped in and started doing PR for me. She got my which it took me forever to get my stuff together, my website. So if you see my website, that's Shayna. If you see, she got the person to design it for me. My EPK, that's Shayna. She did everything. She's an amazing person, amazing connector. So when several weeks ago, when she reached out to me, or when I saw that she was experiencing that she had COVID, and then she called me, I was like, whoa. I was so blown. This was the first time it hit home, hit me so close to home, where it was like, oh my God. And then knowing that other friends had it, it was just like, okay, this is something that needs to be talked about, and people need to be aware, and we need to educate people and celebrate the survivors and not talk so much about this person gone and that person's gone. But there's people who may be experiencing symptoms and don't even know it. So my question to you is, when did you start noticing that you weren't feeling like your normal self? And did you go and seek any help from before you went to the ER? Like, tell us about that.
Yeah, so as everybody knows, we experienced a lot of wildfires in California over the summer. So this was about mid-September, and there was a lot of ash falling down, and I was coughing quite a bit. But I thought it was, due to my asthma or just, seasonal, conditions in the air. So I went to my pulmonary doctor, my asthma doctor, and we had a virtual visit. And she said that it was asthma as well. It's just seasonal allergies. So I was diagnosed with just, mild symptoms of asthma, and they prescribed Singulair and Zyrtec. So I started taking that, and I started feeling a little better, but my cough was just still pretty persistent. But not to the point where, and I was in a dry cough. I didn't have a fever. My energy level was still pretty okay. And then about 6 weeks later, I noticed that my cough was getting worse. Mm-hmm. And at that point, I was still feeling pretty okay. I had just, went to an event, and of course I wore my mask, and I just want to say that I had been wearing my mask the entire time since the shutdown, social distancing as much as I could, aside from the grocery store and everyday runs. But so about the next day, that night, the following night, I woke up in the middle of the night, and my heart was palpitating, racing fast, and I could not breathe. It felt like I was gasping for air. It felt like I was drowning underwater, and I knew something was wrong. It took me about 30 minutes just to walk 2 feet to my door. So immediately I knew something was wrong. I called my neighbor, who's a dear friend of mine, and she's also a school teacher, and she told me she would take me to hospital. So I went in, and that's when things got spiraled out of control from there.
Wow, I didn't realize that you had the symptoms that long, like 6 weeks. See, and they make us think that, well, if you don't feel anything within 14 days, which is only 2 weeks, that you're good. So that means people can have this virus in them for way longer. So yet again, misinformation that's been given to us. So, I think if people have better information, we could have saved more people. So, okay, so and at that point, then you was going to your door, and then you went to the ER. You called 911, and you drove there. Like, how did you get there?
Yes, so my neighbor took me, and she dropped me off, because at the time they weren't letting anyone in with patients, just because they want to make sure they limit the amount of people to get exposure if they're around people with COVID. Okay. So she dropped me off. I went to a wheelchair, and they gave me a rapid test, and I waited. But then as I was waiting, they took my temperature. That rose to 103 to 102. Wow. And then my oxygen levels started dropping pretty rapidly. Wow. And once they think that you have COVID, they greet you with hazmat suits. I call them Ebola virus suits. Oh, God. And they introduce you to what is called a doctor that specifies in COVID. So I ended up meeting that doctor, and he basically told me prior to even getting the results of the test that I had every symptom of COVID patients that come in, and they want to admit me based on my, immediate signs. Like I said, my oxygen level ended up dropping to 68. I could not breathe. They instantly gave me, an oxygen mask. Wow. My heart rate started, speeding up and slowing down. I was given an EKG that came back inconclusive. And then a few hours later, when my blood work came back, so they draw blood, my white cell count rose to 28. Now, normally when you're on steroids, your white cells can raise a little. But I
Okay.
hadn't taken any at that point,
Wow.
and that was a deep concern for them. So I tested negative with all the infectious diseases tests that they gave me,
Hmm.
and I tested obviously negative for the flu, because that's another thing they do. They test you for everything else to make sure that, you know, they're not wasting resources if you don't have COVID. They
Right,
want to make
right.
sure that, you know, you're okay. So basically, when all those came back negative, but clearly I was fighting, you know, a viral disease, they pretty much figured that it was COVID. So
Wow.
my rapid test actually came out negative, but due to my, you know, condition and, you know, my vital signs kind of going down, they
Right.
kept me overnight, and they gave me what's called a 5 to 7 day
Hmm.
test. And a lot of them can now get it back within 24 hours, which I did.
Okay.
And that test came back positive.
Wow. So
And
what?
that's a good thing for people to know as well, that the rapid test, a lot of them do come back negative, because, you know, they need further testing to really see what's going on with your antibodies.
Okay. Okay. So what? So at okay. So at that point, when you tested positive, I know so much is going on through your head because you can't breathe. They're telling you about your white blood cells going skyrocketing, your oxygen levels are plummeting. Like, what's going through your mind right now? Especially what's going through your mind when they say you have COVID, you are tested positive for COVID. Like, what goes through your mind? Are you thinking about like all the craziness that you've heard, on the news, or what is your mind? What is your state of mind at that point?
Yes. So at that point, because I obviously you can't see your family, I don't have anyone with me. I was, my anxiety was through the roof, which was actually making things worse. And they did give me an Ativan to make sure my anxiety was down a little bit,
Mm.
because the feeling that you get from not being able to breathe, you instantly go into panic mode,
Oh God, I
and
can
that
imagine.
exasperates, your condition in the moment.
Wow.
So they gave me an Ativan to calm down. And, I'm not going to lie, I thought I was going to die. It was to the
Right.
point where, you know, prior to going to the hospital the day before, I was fine. I was walking around,
Wow.
I was hiking, still coughing. And then from
Right.
going from just being completely feeling normal, aside from the cough, to feeling like my last cough was going to be my last breath. That is the
Wow.
feeling that you end up having. You feel like you're literally drowning underwater, and they can't
Wow.
find out why, because this virus, there's no cure, so they only treat the symptoms. And
Right.
I don't have other underlying health issues.
Mhm.
Um, and that was on my side. For those
Wow.
that do, it makes things 10 times worse.
Right. And my friend, that she just described it the same way. They described it as, they felt like they were drowning. They felt like they couldn't breathe. But the can't breathe, but the drowning part. So I'm assuming that's the lungs filling up with fluid. That is so crazy. Like, I couldn't imagine. So, so after like going through the process of getting admitted into the hospital, what was your journey like in the hospital during these weeks? And like, when did they decide that you needed to be on the respirator, or did they immediately put you on the respirator?
Yes. So when they take you to the COVID floor, they, show you to the team. It's called like a COVID. When you go on the floor, it's a COVID unit floor for COVID patients only.
Okay.
Meaning you can't leave your rooms, you can't have visitors. It's a very exclusive floor. And when I got up there, the floor is like to capacity. So
Wow.
it was pretty scary. But the nursing staff and my doctors were amazing. They were so kind. But again, I didn't think I was going to make it. So one of the first things they ask you before you they do anything to you is they ask you if you'd like a will,
Wow.
especially if you're in under duress, as I was. And I of course said yes. And at that point I didn't think I would ever see my friends and family
Oh
again.
my
I was
God.
very, very sad. I was scared.
Right.
And yeah, and it felt like, I was cheated out of, an experience of life that, I hadn't quite lived yet. I'm only 36 years old,
Right.
and I just had flashes of my family
Right.
who live, in Ohio. So they couldn't come out to see me even if they wanted to, because no one could come to the floor. So I was very scared, very, very scared.
I can imagine. I remember the day that you called me and to us to talk about the breath works. Guys, when I heard her voice on now this is the Shayna that I'm used to hearing. This voice is what I'm used to hearing. And when I heard her on the other side of the phone gasping for air, and it literally, I mean, I can say it now because you're fine. It sounded like she was dying, and it literally broke my heart. And I just immediately started crying. I'm like, my friend, oh my God. And even though this was her getting better, where she was able to talk, I can only imagine what it was before. So that's what it's like. This is like a really, really serious thing. So when you got people that's in higher power talking about things are a hoax, no, it's not a hoax. Like you telling you that you don't need to wear a mask. Yeah, you need to wear a mask. You need to do everything possible that you can do to, try to avoid, try to, and even though she did everything that she could, sometimes things happen, but you need to know what to do and what to look for. So going back to your journey of like with okay, you filling out the will, and that would have killed me right then and there. I probably would have been hysterical. They probably would have had to call the priest in or something.
You're gonna make me cry. Yeah, it was pretty scary. It was
what?
it was. I think it's you hear everything on TV, you see everything on TV, and I've heard a lot of people say, oh well, it only happens to so many people. More people die of the flu than they do of COVID, and that's absolutely not true. This virus is new. It hasn't been around long enough to even compare it to seasonal flu deaths. And what has caused those deaths, a lot of times, is underlying health issues that, push those deaths during flu season. This is different. It is a virus that's attacking your body, and there is no cure. There's nothing they can do about it. So in my mind, I was terrified. I really, I didn't think that I'm getting emotional now that I was going to make it out of it, because at the time I was so bad. I wasn't even able to really fill out my will because I couldn't breathe. The way that I can explain taking a deep breath is it felt like every time I took a breath, 1,000 knives were stabbing my lungs. So every time, you breathe or talk, you really feel like you're paralyzed. You can't do anything. And like I said, you compare that to what you hear on the news and media, which I think, definitely, made me feel like, okay, I'm starting to sound like some of the stories that I've heard. And normally I would say, oh, well, that's, PR, that's, media
they just pushing
talking,
fear,
and it wasn't. It's not. It's not at all.
So just tell us.
And I actually want to say, I'm so sorry.
Oh, no, go ahead. Go ahead. No.
I want to say this too. The media is actually downplaying the severity of this virus, in my opinion, and the effects of it on our bodies. I think unless you've had COVID and this, in the most worst part of COVID, you won't understand how dire this virus can make you feel, how your last prayer is the only hope that you have. And me reaching out to you, I was looking on my phone and I saw that breathing techniques were what was helping a lot of people out of this. And even though it hurts, for anyone that has COVID right now, please do it. The breathing techniques, breathing in for 5 to 8 seconds and holding it and then releasing it, made a significant difference, even from what they were giving me. and we can go into that too. But I did find that those techniques definitely helped me get better. So
right. So yeah, that's the thing. It's like, okay, so and that like those, and I'm glad that you're highlighting those symptoms and what it feels like and what, because like there's a lot of people who don't like to go to doctors and they go through certain things. And I know me, I'm a hypochondriac. So any little thing that's off, I'm at the doctor, I'm calling. I know my doctor is like so annoyed with me because like I have an appointment with him in like 30 minutes because I'm like, okay, I need to check this out. I know he's like, this lady gets on my soon he's gonna start denying me appointments, but but everybody's not like me. Everybody, there's people who will try to, I'll say thug it out, like try to, let me drink some tea, or let me do this, or let me do that. Like, so it's so good that you're, highlighting the symptoms. So is there any other symptoms that besides the breathing or like, that you feel? And then another thing, when I was speaking to you earlier and then speaking to my other friend, is like all these after effects of like that's after COVID. But before we even get to the things that's after it, like, so can you like explain to me and us, like when you were in the hospital, like this, not only just the staff, but like what did they do, and like how long were you there, and what was the day-to-day life there, and what is, I've heard people that's on the respirator, but what is that like? Is that painful? Is it a tube down your throat? Like, is it just a mask? Because I don't really know what a respirator is, and maybe other people might not know, or maybe I'm just the only idiot out here. But like, what is it? Like, what is that process?
Yes. So basically, when you're at the point where oxygen level is dropping, they give you oxygen, but respirators are somewhat, the same as a ventilator.
Okay.
And they use that in terms of giving you oxygen.
So you were saying, you was explaining to us what the respirator is.
Yes. So those are for people who can't breathe on their own. And of course, I'm sure they have many to make sure that those that are not responding well to the medications they start you on. So when my oxygen levels started dropping, they also do blood work. My red blood cells, which is called hemoglobin, those started dropping as well. And that's actually one of the indicators that my doctor kind of knew that it's possibly COVID before even my test came back positive. And basically how that works is your red blood cells pump oxygen to your heart and your lungs. And when they have to work overtime, they tend to go down because they're doing so much work. And so I had to get blood transfusions, but in the midst of that, they give you a cocktail of azithromycin, which is an antibiotic, and then they give you prednisone, intravenous prednisone, and I mean a whole lot. And I was curious at the moment, and I asked my nurse. I said, why are they giving me azithromycin, intravenous azithromycin, when that's for infections? That's not for viruses. There is no cure for a virus. When you get a cold or the flu, you have to wave it out because it's a viral infection. It's not an infectious
like a bacterial
disease. Right. So she notified me and told me that for some reason, the mix of the prednisone, which is a steroid, and the antibiotic seems to be helping COVID patients around the country and around the world. So I asked her, I said, is this disease or this virus like a hybrid of an infection and a virus? And they don't know. So the more we learn about the disease, hopefully we'll find out, what's going on in that respect. But all they can do at the moment is treat the symptoms of your diagnosis. They can't actually give you a cure. They can only treat the symptoms and hope that those go away, depending on how vigorous this virus is and how it attacks your body. So at that point, they wanted to make sure I was, I had a blood transfusion because my hemoglobin dropped from the night that I was admitted. It was, I think, 9, which is still pretty low. I'm anemic anyhow, but it went from a 9 to 6.8.
Wow.
Now, the average hemoglobin should be at least a minimum of 12.
Right.
Anything under a 6 you get a blood transfusion. And it just started going down more and more and more. So then that's when they did that and gave me tons of, liquids, intravenous liquids to just make sure I was hydrated. At this point, I had no appetite.
Oh, that's what I was going to ask too. Do you eat? Oh, okay. Yeah. Oh God. Yeah, I was gonna ask that. Like, can you eat? Like, how do they give you nutrients? Because you also need that to be able to fight.
Exactly. So no, I wasn't eating. I didn't have an appetite. I was actually extremely nauseous. And when you can't breathe like that, your first thing is like, help. Like,
right. Right.
When you're drowning in water, normally people scream out, help, like I'm drowning.
Right.
And that's how I felt in a moment. So, but I was lucky, and I mean this in the best way, but I was lucky to catch this virus at, the peak of, our medical doctors understanding it to a certain extent, meaning that there were already so many patients that they saw that went through this that they knew kind of what's working and what isn't. And I think that's why you saw so many fatalities at the beginning of the virus, because, the doctors were, thrown for a loop. They had no clue what works, what doesn't. They didn't have anyone to even figure out, if these things worked or if they didn't. So I was lucky in that respect. They knew exactly what to give me. And, I wasn't sleeping because, again, that's the hard part of not being able to breathe. You're coughing so much. I was coughing more than I could, talk. So that was another problem to this virus is that, your body can only take so much. And when a virus hits your body, everything that happens from coughing to nausea is a side effect of that. It's a symptom of that. So,
and all that coughing makes your body ache. Like your body, when you coughing all the time, your body is aching and all this other like that is the worst feeling. I hate when I get sick and I'm coughing. So I couldn't imagine, the constant coughing, the body aches, and you're nauseous. I hate being nauseous. Like it just sounds like a recipe for just like madness. Like this is like your worst nightmare. So I remember yesterday when we were speaking, you was telling me about code blue. Can you explain to everyone what the code blue, and everyone just think about this is like, it's to me like when she explains everything to me, and as I'm hearing it again, and people approaching you in hazmat suits and stuff like that, that sounds like a horror movie. And it's just it seems like a big horror movie. And it's just like that alone will mentally send you, through the roof. Like that will bring up, and if someone who already suffers from anxiety, that will just trigger more anxiety. Like everyone's talking to me in a hazmat suit. Like what the hell? Like, okay, so code blue.
Yes. So you brought up a good point. When your doctors and nurses greet you and talk to you, they're in hazmat suits. And, as I, started getting a little better and I was trying to sleep, every 4 hours on the announcement, you would hear code blue, over and over and over. The floor that I was on, the COVID floor, there were a lot of elderly people on the floor. I think I was one of the youngest, so to speak. And my neighbor was an elderly man, and, you're not allowed to leave your room. If you need anything, you have your call button, and the rooms are pretty spacious, but when you're that sick, you're not looking or thinking about that. You just want to see family and friends and feel comforted. And the nurses were understaffed, but they did everything they could to help. They were angels, blessings to make us feel like, they were our second families. But there was a man that was next to me, and he kept screaming, I want to go home. And I don't want to cry it now, but he was an older gentleman, probably 89, 90, according to my nurse. And he was screaming, please, I want to go home. I want to see my family. And he walked out in front of my door and was vomiting everywhere, and he was scared. And they just, took him back to his room, told us not to be alarmed. And then I found out about, I think 2 days later, one of the ladies, the older ladies that, were a few rooms down from me, she was probably in her 70s, she died. And
Wow.
it starts to psychologically really mess with your head in the sense that, you know, you thought you were perfectly fine. You know that you're in good hands with these doctors. You feel confident. But at the same time, you're seeing the results of this virus all around you.
Right.
You hear it.
Right.
You're hearing it from people that want to leave. People are scared. You're scared.
Right.
So it almost feels like, they're waiting to die.
Right. Like
Because
I
that's the
know.
thing with this virus too, is you get better and then you get worse, and that's what happened to me. I was
Wow.
getting better and then I got worse. Got better and then I was at my, like, just the worst part of this disease.
Wow.
Yeah,
Wow.
I was
Wow.
terrified, and I just I think when you're hearing this too, and I want to hear this as well,
Mhm.
you think about your father, your mother, your
Right.
loved ones who are older, and how they don't deserve to die this way. Nobody
Right.
does. I don't care what age you are. No one deserves to die alone, away from their family, scared and terrified.
Right. And
That's just a
basically
horrible way to
helpless.
die.
Right. Exactly. And that's another thing I was gonna ask you, you know, and I'm sure, like, how has this experience, like, changed your perspective on life? And I know, like, would you say that people definitely need to cherish their lives a little bit, well, not even a little bit, way more, and express way more gratitude? Like, I feel like a lot of us do not appreciate the fact that we can breathe on our own. The fact that there was so many people during quarantine and when this thing happened that was complaining about the smallest things. Oh, I can't go out. Oh, I can't party. Oh, I can't do this. Like, oh, I'm not getting all I'm getting is unemployment and da 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 da. And like the little complaints that these people had that was, compared to someone and you and hundreds of other thousands of other but hundreds of people on your floor fighting for their life, fighting for a moment to breathe. These people are walking around breathing and ungrateful that they can take a breath. So, it's like I would
Yeah.
imagine it has changed your perspective on life and like what is on the other side of surviving. What is your thoughts in reference to just life and how us as human beings need to live?
Yes. Absolutely taking life for granted. It made me look at, you know, and I'm not saying this in terms of, globally, because I'm not in Italy, I'm not around the world in places where they seem to have a little bit more compassion for their
Mhm.
fellow citizens and people.
Right,
But America, we're getting it wrong. We're
right.
being very selfish.
Mhm.
Not only was I, able to kind of look at and be so blessed to have a second chance, in my opinion, at life, and make it out of this, but it also showed me the selfishness that our fellow Americans have in terms of having empathy for people
Right,
who deserve to have that chance at life, and not wearing something as a simple mask to just prevent that. We
right.
are overseas and we help people and we do all these different things. And it was the first time that kind of showed me the lack of empathy that,
Right.
we all have for one another. And I think that that's what hurts the most.
Mhm.
If anyone could experience what I experienced, and if you can have just imagine, your grandparents or the people in your life that you love the most dying and begging to see their families at their last breath, I think people would have a little bit more appreciation for the tactics that are helping people. This is not a hoax. I don't care what rhetoric, is coming from the top. This
Mhm.
is real. And wearing a mask, washing your hands, and social distancing, these things will, increase, the life expectancy of a lot of your loved ones and even yourself.
Exactly,
And I think I
exactly.
wish more people understood the value of that.
Right. And what people need to really understand, and I feel like they're losing sight of, just because you don't have symptoms and you're not struggling does not mean that you're not a carrier. Like, you could be a carrier. Your immune system could be in there kicking COVID's ass. But the person you walk next to selfishly without a mask, immune system might not be ready for that fight, and you infect that person. And I'm sure and then especially when you're out there with people who have, who older people, children, people with underlying diseases, it's our duty to be responsible for everyone else. Don't be selfish and think because, well, I'm fine and I don't have this and I don't have that, that you should be just all willy-nilly breathing. Like, it infuriates me when I'm on the train and it's a closed-in space. I'm in New York and people have their mask off. It's the law to have your mask on. So I feel like you're just selfishly trying to prove something, like saying, well, I don't have to listen and I'm not going to follow these rules and blah, blah, blah. It's not about you, it's about everyone else. So it's like, it's your duty as a human being to make sure that everyone is okay. I take vitamins every day and I do this. And one of my friends who also was sick was a very, very healthy person, worked out every day, was a very fit person. And they got it and they went through, basically almost died. So you can't say, well, I'm healthy and I do this, I'm fine, or that person is sick, that's why, or that person is old. That it can hit anybody and other people suffer more. But you could also be walking around healthy and fine. Shayna was walking around for 6 weeks with it, not knowing. So we have to be responsible. I'm sorry, I didn't mean to start preaching at everybody, but
It's true. I mean,
my sermon on the mountain, but
yes, it's so true, and it's something so simple.
Yeah, so
there's a lot of
simple.
conspiracy theorists that will try to vet, people into thinking it's something it's not. And no, this is real, and it can happen at any age. I'm fairly young, and it can affect anyone.
Right.
And if anything, too, like you just made a great, comment about people who are asymptomatic, and there may be a lot more people who are asymptomatic than people who will catch COVID. This is new; they're learning. But if you knew, it's no different than. Okay, this is a great example. But if someone were to rob someone and you knew of that robbery and you could stop it, you would help them. You would tell them stay home, call the police. Make sure you're protected, make sure you're okay.
Right.
Wearing a mask is doing that for people who either have underlying health issues or people who don't. Right. And I think, we have a moral responsibility to protect, our fellow man.
Right.
And it's so disappointing to see. I have a brother who, I love him, but in Ohio, but he and his wife, they don't believe in this, and they don't wear masks. They go to parties. They throw many parties.
You should have been the wake-up call. Like, what is the problem?
I know. My mom. Well, it's interesting because my dad is a dialysis patient, and, my mother, she's, very healthy, but, they still insisted on, seeing my parents. And my mom basically said, no, what if your dad gets COVID and exposes it to his dialysis unit, which most dialysis units are, filled with a lot of elderly people who have underlying health issues. And it's just the selfishness of this. But I do think it comes from the top, the rhetoric. It's like climate change deniers and people who don't believe in environmental distressors and things in that aspect. And this isn't one of those. This isn't the time to do that, and I just wish that more people would just, have empathy and really care for their fellow man.
Right. So before we go, I want you to just because I know that you've been talking about the aftermath of it, like because it's like the journey of COVID and being in the hospital is not the end of it. There's so many different things that still left over that you have to deal with. Like, so you can explain to us what your other symptoms are afterwards, the after effects of COVID and life after COVID, and then things that you've been doing to become more healthier, because I know you changed your lifestyle and what you're eating and stuff like that, and the things that you've been taking. And so just explain those things to us. That way people can kind of like, if they even had just the lower forms of COVID and haven't had, because I know other people who've had it and, they weren't to the degree of you, what can they do?
Yes. So once I finally left the hospital, they give you a prescription. Well, they gave me prescriptions of prednisone, which is a steroid. So I had a 10-day version, and then if things weren't better after that, they put me on another 10-day prescription until I was able to kind of stop coughing and breathe without having trouble breathing. Even just walking was a problem. So as I was getting better, I did notice that a few of the generic forms of the medication that they gave me were making me feel sicker. In terms of not being able to eat, not being able to sleep. There are side effects to having that much steroids in your body. Most people that have taken steroids their whole life or had breathing treatments due to asthma, the symptoms of shaking hands and, the feeling of having, being overly, energetic in terms of like your hands shaking and just feeling like buzzing through your body. Wow. So it was times 10, for that feeling for me. And I actually went a different route. I started juicing. I did a 2-week juice cleanse, and that helped a lot of anti-inflammatory foods. So a lot of fruits and vegetables, ginger, turmeric, sea moss. I did a lot of pineapples, celery juice, just a little bit of everything. And I started feeling a lot better. I took away red meat. So, pretty much no meat for about a month. And I just wanted to, put good things in my body. And I drank a lot of water. I was up to almost 1.5 gallons of water a day.
Wow.
And I noticed just getting that medication they gave to me out of my system started helping as well. And I didn't feel like I was codependent on it. And then, of course, the breathing treatments, the breath works, and continuing that space, yoga, a lot more, deep breathing yoga made me feel like a lot more centered, and kind of like, because it does make you feel like your body was taken away from you, and you're giving it back. But then it's like, okay, what do we do now? We have to start from scratch and figure out.
So the breath works. So the breath works was beneficial, because I remember I sent you the videos and stuff like that. Okay, so it did.
Oh my gosh, you're an angel. Because during my worst time in that hospital,
oh my God.
Like I said, that's the thing that they tell you the most is try to do breathing techniques, and the breath works helped. It hurt.
Yeah.
Sometimes it felt like it wasn't going to work, but then slowly, day by day, you see that it is working, and you just really have to fight for it and just do it. I know for my, the people out there that have COVID, that are having problems breathing, please, just like I said, hold your breath for 8 seconds, take a deep breath, hold it for 8 to 5 seconds, and let it out. And I know it's hard, but do is, at least about, 7 to 10 times a day, and you'll feel a lot better. Try to stand up, try to keep your posture leveled, because if you do start to have pneumonia, you don't want the fluid to kind of fill up in your lungs to the point where, there's not much they can do after. So being sedentary tends to cause more fluid to go into your lungs. So you kind of want to make sure you walk around, even if it's for 10 minutes. I know you don't feel your best. It's definitely important. Another side effect that I had from COVID, as far as the side effects, I ended up getting a rash. It's called a COVID rash all over my body. I didn't know why. It looks like hives. They're the color of your skin, so they're flesh tone, as my nurse would say. And some of them are red. but it goes away. But it's part of it's part of the after effects. Another really big issue that I've had since COVID is memory loss. So I can lose my train of thought within 60 seconds. I was talking to you yesterday, and I'm a publicist. I'm a talent manager. It's my job to have a great memory and make sure that I'm able to provide those services for my clients. So it was really frustrating for me to forget the simplest things, but even like long-term memory, and that's something that they're looking into. I hope that there's no long-term damage to that in terms of dementia and onset, things like that. But that's been a big struggle right now. It's just forgetting memory loss. It's been so.
Oh God. Well, Shayna, I'm so happy that you took out the time to share this with us. I mean, this is priceless information, and hopefully it'll save some lives or make, help people just get into, be more aware and at least be able to, if you are having these symptoms, know what it is and know what to do, or just be aware. That's basically what we want to do. And I'm so glad that you were willing to share and open yourself up, because I know a lot of people are at this time scared to share their story because they don't want people to start running from them like, oh my God, they got Ebola or something like that. So thank you so much for sharing, because we haven't heard it and it needs to be told. So thank you so much for sharing with us and, taking time out of your busy schedule. And I'm so, so happy. If I didn't say it to you before, I'm so happy you're still here. I love you to death. I'm going to be I'm going to be back. I'm going to be in LA and we're finally going to be together hanging out with our mask on.
Oh, I'm so excited. I'm so excited. We've got work to do.
Yes, we do, because the chapter. If the universe brought you through this, it means that your chapter is not, your story is not over. That was just one chapter, and it's on to the next chapter, and that's all that is. So, thank you. And guys, I'm gonna share all of Shayna's information so that you can follow her and just maybe hear more of her story. I don't know if she wants to share more stuff. I'll send you guys that information. So thank you guys for listening, and I hope you learned something.